So in this section, we thought we'd look at medication, and we were sort of talking earlier about when people first go to the GP, and I think it's quite common now for GPs, as well as discussing kind of going waiting lists for talking therapies, that they would certainly discuss, if not sort of start medication. So would it be helpful to talk about kind of the role of medication and anxiety and depression?
Yes. Medication is very common in the treatment of depression and anxiety. And the reason for that is because the evidence shows that it works for the majority of people. Back in the dim and distant days of the 60s and 70s and 80s, some of these drugs had very difficult side effects, very addictive in some cases, and overdoses could be terminal. It's moved on hugely now. They're much safer, they're much better understood, lots and lots of trials to make sure how to make sure you don't combine them with other drugs that might be bad combinations and so on. The majority of people, around 75% of people, will benefit from antidepressants or anti-anxiety drugs when they are prescribed. You're right, GPs will prescribe them now. I think there's some evidence for this. It's partly because the GP's choice in practice, particularly for people who are depressed, is to either give them an antidepressant or to say, we can't really do anything for you for 6 months.
Right.
And that's, it's, I'm not saying anyone's over-prescribing, because nowadays, as I say, the side effects, we'll come on to those, they're manageable, they're well-tolerated drugs, and again, they tend not to be dangerous, though you should never ever exceed the prescribed dosage. If it was to be accidentally overdosing, it's not as bad as it used to be. So there's very little downside and potentially quite a big upside in the prescription. As I said before, the research is quite clear now, particularly for depression but also for anxiety, that the most effective treatment is a combination of medication and talking therapies.
Okay. So I suppose it's helpful for people to understand. And I think one of the classic problems that often happens with medication, particularly SSRIs, which are often the most common ones, serotonin inhibitors. I can never remember what the full bit of SSRI stands for. And they're very often the first the first type of medication. But often one of the difficulties can be the GPs will often say it takes between 2 to 4 weeks for the benefits to kick in, and it can take a little bit longer. I've known people it takes a couple of months for the benefits to arrive, but the side effects will happen very, very quickly indeed. So if someone takes a medication, immediately they start feeling worse, and they may be feeling worse for several weeks before they start feeling any improvement in mood.
Yeah, so. that can be an issue. To be fair, nowadays GPs are very alert to the experience of the patient as they take the drugs. They know from the evidence that they work, but the sequence of events has to be clear. So just to manage the expectations of the individual is really important. And if you're the carer going along to the initial GP consultation, it's one of the things that you can do. If the GP doesn't mention about that sequencing of side effects and benefit, it's worth just saying, can you just clarify, doctor, what the sequence
when's this going to happen?
Exactly.
What's the sort of time scale?
Indeed. SSRIs, sorry. Yeah.
Oh no, I was just going to say, and that can particularly be an issue because quite often it may take a little while to find the right medication for someone. So they might start more medication, it's not quite the right one, doesn't either the benefits aren't quite what works, or the particular side effects aren't that well tolerated, so they may move on to another one. But if it can take a month or two for the benefits to kick in, then it can sometimes be a cycle of a month or two on one type of medication, we try another one, there may be a month or two. So if you're going to try 3 or 4 different medications before you find the right one for you, that can be a process that might take 6, 8, 10 months.
Sure. No, you're absolutely right. For most people, though, they wouldn't go through a sequence of them. Normally, if they're prescribed an SSRI, a and just to say, it's the selective serotonin reuptake inhibitor. And I make point simply because we don't want to have serotonin inhibited. Serotonin is a good thing. It's a neurotransmitter which basically sends a signal from one nerve cell to another. But once it's done its job, as it were, it gets reabsorbed back into the cell. And we know that the more you can help the serotonin stay active, the better the person will feel. Hence the name reuptake inhibitor. Reuptake is it being brought back in, so you want to delay that process. So that's why it's good just to know that. Some of the key ones, fluoxetine would be a form of SSRI, very commonly prescribed, and under the brand name Prozac, probably better known, very commonly prescribed. Others are sertraline, which is very common, particularly in the UK. It's exactly as you say. The benefits will take at least a month to kick in, but the side effects can be quite immediate. So we know the different people react in different ways, but there might be a general nausea, there might be some indigestion or constipation. For some clients, not very many, but some, there might be some dizziness and agitation. Just keep an eye open for that. And some headaches are possible. A GP
will often go through that with someone. I think one of the other things that's really helpful for particularly the GP to be in charge of that is that people may be on other medications as well. So particularly if the anxiety and depression is secondary to another physical problem, that is their primary issue that they're being looked after, that you're caring for. So it may be that they're on heart medication, BP, blood pressure medication, diabetes medication. And so the GP can often work out what's the best combination to avoid certain interactions.
Absolutely. You can't blame busy GPs. They're keen to give you all the care that you need, but they do have people in the waiting room. And I think it's the case that the GP might say one or two words about side effects, but read the leaflet. The problem is that not everyone reads the leaflet, and the leaflet, for legal reasons, has 15 pages of things that could go wrong, and you think, how do I engage with this text? So in that context, yes, you do want the GP to be clear about potential side effects. They absolutely want that. This is, as I was saying earlier, one of the really important reasons why, if you possibly can, go through the GP to access other therapies, because they will have your full medical history, and that's important. I wouldn't underestimate the role of the community pharmacist in this context. They have access to very complex databases that will indicate what kind of side effects might occur for you, given that you're a certain age, certain sex, certain ailments, other medication, etc.
And actually, that's a really good point. Pharmacists can be really good people to discuss side effects with.
Although
you might ask the GP sort of in abstract, if you're going for the repeat prescription, if you've got anxiety, sometimes saying to the community pharmacist, look, I'm having this kind of reaction. Do you think this might be linked to the medication or not? That can be really helpful.
Absolutely. I mean, the guidance given to GPs now is that when you prescribed antidepressants in particular, you should get the patient to book in with you 2 weeks after that to check how it's going. I'm not sure that always happens, but if the GP invites you to make a follow-up appointment to check how the medication's going, then clearly it's a good idea to take that up. But you're absolutely right. You speak to the pharmacist who can give you good advice on managing drugs. One other thing, which is sometimes overlooked, but some drugs don't sit well with alcohol. It's not prescribed so much now in the UK, but it sometimes is benzodiazepines, which is very dangerous to take with alcohol. So it's not just medication that you're on, it's other fluids you're taking into your body, and of course other drugs, illicit drugs, cannabis, can have a detrimental impact on not just psychological well-being, but also in terms of interaction effects with medication. So this has all got to be looked at very carefully. But just to make the main point, most people do not have severe side effects. The drugs that are used now, SSRIs, some of the even more advanced ones, are very low on side effects, very well tolerated. You're absolutely right about some individuals. They do need a bit of time to say this isn't working. Okay, let's try this one. But also about the dosage. The GP will start on a relatively low dosage, maybe just 5 milligrams a day for some elements, and then if it doesn't seem to be working, or it's working okay, again it's a tricky one, to increase the dosage a little bit. And to see if there's an impact there. So medication is definitely something which should be taken into account,
and I suppose
it is beneficial for most people.
And there are two side effects that's probably worth kind of particularly picking up. I think one is, and it is very rare, but for some people it can actually cause a dramatic lowering in their mood, and it can be associated with suicidal thoughts. It is very, very rare, but that can often be one of the things the GP wants to check in, because if someone's depressed, their mood's very low, just to check that very rare interaction hasn't happened. But it's worth being aware as a carer, if someone's mood suddenly deteriorates very quickly after starting it, just being aware, actually this could be the medication. Let's have a
absolutely. And of course, some people are still hesitant about asking, have you had suicidal thoughts, love? Because they don't want to put the idea into their head. That's not the way it works. It's almost much better to be direct and clear about the question. If you've got grounds, ask the question. You're absolutely right about certain drugs lowering mood and even creating the possibility of a risk. This is true for young people in particular on certain drugs. Won't get into the details here because it's very much a technical and case-by-case basis, but the GP will be very alert to that and make sure that there's not a mistake made in any prescribing. But generally, the experience of most people on antidepressants and anti-anxiety drugs is mild degree of some side effects initially, and then after 4 weeks or so, they do start to see the benefits. It lifts their mood, calms them down, and comes back to that thing we spoke about earlier about that little ray of light, an option, possibility when the drugs are kicking in, and maybe the person's also had maybe 4 weeks of counselling alongside of it. That's almost like a golden spot to start to explore more activities externally and start to have conversations about, are you really sure that going to see the grandchildren would be such an awful thing for all concerned? You can have that conversation more easily. They'll be up for it.
And that's one of the benefits as well of things like journaling, because if you notice that actually my mood in February is much better than it was in January, which is much better than December, that it's easier to pick up those slow improvements, which can sometimes be a bit difficult on a week-to-week basis. One set of side effects that we didn't talk about, and often GPs will, but it's an area that sometimes they may not be as comfortable with, is that it can have sexual side effects. So it can lower people's sex drive. Occasionally with men it can cause degrees of erectile dysfunction, and again that can cause some anxiety and depression around that. So just kind of being prepared and saying, look, these are they're rare side effects, but they're normal side effects. And again, they're things that you can talk to the sort of GP about.
Absolutely. It tends to be more of an issue in anxiety, because people who are anxious are just as likely to have active sex life with their partners or otherwise, as anyone would. There's a bit of a reduction, but generally it can be sex active. Whereas a depressed person who's severely depressed will have lost interest in sex sometime previously. So they might notice the erectile dysfunction, but they won't notice particular loss of sexual appetite, because that's probably
part of the depression.
That's part of the depression. But you're absolutely right. It is a classic example of something which, if the GP mentions it, then you know that's what's happening. It's not something else. So the conversation about side effects is a very important one, because it would be very unfortunate if someone gave up on medication that the GP had thought very carefully about what would be the right dosage, what would be the right timing, what would be the right type of drug for this individual, and the side effect puts the person off when actually they're probably short-lived, and the benefits have not yet kicked in.
Absolutely, and as you said, the research is very clear that medication, particularly combined talk therapies, will have a big benefit.
Yeah.
And I suppose linked to the idea of compliance, and we know that sometimes there can be an issue where people go, look, either I'm unhappy or I don't like the way it's making me think, I'm stopping these medications. It's always worth trying to get the conversation back with the GP, having that consultation, to either see if there's ways of managing those side effects, whether there might be another medication. One of the problems that can happen if people have been taking it particularly if people have been taking it for quite a long time, and if the doses are quite high, suddenly stopping taking medication can cause in some cases can be very dangerous, but in most cases will have quite an effect on someone, just that sudden rapid stop. So even if it's not the right medication for someone, if they've been it for quite a long time, the GP will often say, well, actually, we need to kind of lower the dose gradually, rather than just suddenly stopping medications that you've been taking for a while.
Absolutely.
Can cause real problems.
Yeah, no, definitely. And people don't comply for lots of different reasons. Some people simply forget to take the tablet. And then think, oh, well, I'm just the same. But of course, it takes a while for it to kick in. Other people say, well, I'm better now, I don't need them anymore. Yeah. And maybe that's great if they feel that way, but it has to be a measured process, as you say. Another area we shouldn't overlook is bipolar disorder or bipolar depression, where of course, as you know, the individual experiences phases of so-called manic activity, high-risk activity, highly elevated mood and high energy, but other phases then of very, very low mood, very, very depressed. There is a statistically higher risk of self-harm and suicide in those cases. But it has an interesting link to medication because the National Institute of Clinical Excellence, the NHS, are very clear that over many years the drug which is most potent and most effective is lithium. And it's not really used for many other things, but bipolar has a very, very strong track record, and people can take it over many years. But some recent research in Scotland showed that in actuality, most people, or many people, I think about half people who are suffering from bipolar are actually on mainstream antidepressants, which are less effective in managing bipolar. So bipolar is very uncommon, but there's an extra conversation there. If the individual has presented to the GP around depression, and the individual doesn't see their hyperactivity as being part of their disorder, may not report it, the GP understandably will treat the depression. But yet, so the carer has a role saying, well, what is it you're going to see the doctor about? I think you should mention the fact that you go for 2 weeks when you're on the credit card and you're out every night and you're full of ideas and you're buzzing. You need to mention that.
So I was just thinking. So it might be helpful to say if you're caring for someone, what might mania look like? So shopping, extravagant decisions, buzzing on lots and lots of ideas, huge amounts of activity. I know people that clean the house from top to bottom at 2 in the morning. That's
absolutely, and jumping about different activities. It is something which can be frustrating and challenging for the carer, because the individual, as you say, with no warning, wants to do lots and lots of activities and expects everyone to join in to some extent. Financially, yes, I mean, there's lots of cases of individuals maxing out their credit cards and stuff they don't want. And equally, when in the phase of depression, it can be a very severe depression, and it can be a precursor to suicide or self-harm. So it is something which has to be monitored very carefully indeed.
And one of the particular issues that certainly I've come across in terms of complying with medication is if people are bipolar, although the depressed moods, the feeling really low can feel horrible, sometimes the mania can feel very exciting, and so something that takes the top off the mania and the bottom off the low moods, sometimes people are, actually I don't feel as creative, or I don't feel, they almost miss the highs, although they don't tend to miss the lows, and again I have seen that as a reason why people may stop complying, and that can be the advantage of having talking therapy, having the GP saying, well, look, you know, let's not lose track of when things were quite bad. You know, and journaling can be really helpful. The carer's experience of saying, well, actually, do you remember that? And that wasn't quite as good as you remember it being.
No, absolutely. And just simple things. A carer can encourage the individual to maybe set an alarm on their phone to take medication. Research shows that as simple and as trivial as that is, it does increase compliance. So overlooking medication. And then there are other things which, you know, is true of any medication. Almost always, if you forget to take the pill on a certain day, don't take two the next day.
Yes.
You know, simple things like that are true of antidepressants and anti-anxiety drugs as much as anything else.
And actually, that can be a really useful thing for the carer. To be aware of what do we do if we miss a drug? Do we just kind of log it? Do you things like if it says you need to take it before or after food, just being aware of what that is. Alarms can be really, really helpful. And again, just supporting that person. Say, okay, look, we forgot the tablet once at lunchtime, but look, this is what we do now. Also, if that person starts losing track of time, then it can be helpful for the carer to say, well, you know, have we taken our morning medication? And that can be really helpful.
Absolutely. And just along those lines, a very practical thing, if you are going on holiday, to remember to take your own medication and make sure that the individual takes their medication with them too. It's always good if you're on medication or multiple medications. If you're going overseas or travelling to a different part of the country, just find out where the local pharmacies are before you travel. It saves you that little bit. You may not have access to the internet in the hotel. It's just worth knowing where the pharmacies are. And of course, one should always have health insurance.
Yeah, and actually that's another thing that can be quite helpful is if someone's given, say, a month's worth of medication, factoring in going to see the GP or getting the repeat prescription, you know, plenty of time. Sometimes, particularly if the person is doesn't want to get out of the house, puts things off, if it's left to the last minute and suddenly there's difficulty getting to the GP or the pharmacist, then you may end up having 2 or 3 days without medication just simply because you've run out of medication. So the care can be really helpful to go, look, we're down to our last week, let's just make sure that we've got enough for the next month or 2 months.
There's been an interesting development over the past 3 or 4 years now in the NHS and GP surgeries. Almost all of them are online now through the national system, where you can request repeat prescriptions online. And it'll be automatic. Well, once the GP signs off on it, it'll be automatically referred to your nominated pharmacy, and you can go and collect it when you're ready. And of course, as I'm sure many people know, there are prescription charges, but you can buy a season ticket on a monthly or annual basis, and that makes sure that you're keeping a cap on the costs. And of course, a season ticket covers you for any medication. So if you're on mentioned earlier about dementia or other physical ill, if you're already on medication, it's important that you have the season ticket, because if you're adding more medication onto it, you don't want to be paying extra, of course.
I hope you found this course helpful. At FCC, we're committed to providing courses and training for unpaid carers, and these courses are completely free. If you found this helpful, you could support our work in 3 ways. Please recommend it to any friends or people that you know that will benefit from the courses. Please consider sharing it on social media. And if you can, please consider donating. There are buttons on the website where you can donate £1, £2, £5, and every pound that you donate will make a huge difference by helping us make more and more care courses completely free to carers. Thank you very much.